Hello and welcome. I'm Dr. Alex Carter. This channel is created and overseen by a board-certified physician and provides general health education for adults 65 to 85 years old. Today, we're going to talk about heart health, specifically what nutrition, exercise, and lifestyle habits are supported by strong medical research and can help support a healthy heart as we age. This information is for educational purposes only and is not medical advice. Always speak with your personal healthcare provider before making changes to your diet, exercise routine, or medications. The good news is this: even later in life, simple, consistent habits can make a meaningful difference for heart health. Let's begin. Part 1. Why heart health matters more. After 65, as we age, several natural changes occur in the body. Blood vessels become stiffer. Blood pressure tends to rise, cholesterol patterns may change, muscle mass gradually declines. Large studies published in major medical journals consistently show that heart disease remains the leading cause of illness in older adults. But they also show something encouraging. People who adopt healthier habits, even in their 70s and 80s, often experience better blood pressure control, improved cholesterol levels, better blood sugar regulation, improved stamina and independence. Lifestyle habits still matter. Part 2. Nutrition for heart health. Focus on food patterns, not perfection. Research shows that overall eating patterns matter more than any single food. Heart-supportive eating patterns tend to emphasize vegetables and fruits, whole grains, healthy fats, adequate protein. They also limit, but do not necessarily eliminate, highly processed foods, added sugars, refined carbohydrates. You do not need extreme diets to support heart health. Healthy fats support the heart. Large studies show that replacing saturated fats with unsaturated fats is associated with better heart outcomes. Helpful sources include olive oil, nuts and seeds, avocados, fatty fish such as salmon or sardines. These foods are associated with improved cholesterol balance and reduced inflammation. Consistency matters more than quantity. Protein becomes more important with age. Maintaining muscle mass supports metabolism, balance, blood sugar control, overall cardiovascular health. Older adults often benefit from adequate protein spread throughout the day. Heart-friendly protein sources include fish, poultry, eggs, beans, and lentils, dairy, if tolerated, sodium awareness, not fear. High sodium intake can worsen blood pressure, especially in older adults. You do not need to eliminate salt completely. Focus on reducing processed and packaged foods, which contain most dietary sodium. Cooking more at home and using herbs and spices can help. Alcohol. Less is generally better. Recent research shows that lower alcohol intake is generally better for heart health as we age. If alcohol is consumed, keep it modest, avoid daily use, discuss it with your doctor if you have heart conditions or take medications. Part 3. Exercise for heart health. After 65 decades of research show that movement is one of the most powerful tools for heart health at any age. Walking is extremely effective. Regular walking is associated with lower cardiovascular risk, improved blood pressure, better circulation, improved mood. A helpful goal for many older adults is 20 to 40 minutes of walking most days, at a pace where you can talk but not sing. Shorter walks still count. Strength training supports heart health indirectly. Strength training helps by preserving muscle mass, improving insulin sensitivity, supporting balance and mobility. Research supports 2 days per week of simple resistance exercise. This can include bodyweight exercises, resistance bands, light weights. The goal is maintaining function, not intensity. Balance and flexibility matter. Falls are a major risk factor for loss of independence and reduced activity. Balance-focused activities can reduce fall risk, improve confidence in movement, support long-term activity. Helpful options include balance exercises, gentle stretching, Tai Chi, or similar practices. Listen to your body. Moderate, regular activity is supported by research. Stop and seek medical advice if you experience chest discomfort, unusual shortness of breath, dizziness, or fainting. Part 4. Lifestyle habits that support the heart. Sleep matters. Poor sleep is associated with higher blood pressure, worse blood sugar control, increased cardiovascular risk. Helpful habits include consistent sleep schedules, limiting late caffeine, daytime light exposure, calm evening routines. Stress management is important. Chronic stress is linked to higher blood pressure, increased inflammation, worse heart outcomes. Helpful strategies include regular walking, breathing exercises, social connection, limiting constant news exposure. Social connection supports heart health. Large studies show that social isolation is associated with worse heart outcomes. Maintaining relationships and community involvement supports both emotional and physical health. Part 5. What makes the biggest difference? You do not need to do everything perfectly. Research shows benefit from small, consistent improvements movement most days, simple, heart-supportive eating patterns, maintaining strength, balance, and connection. Even changes made later in life can support better heart health. Outro. Thank you for watching. This channel provides general health education and does not replace care from your personal healthcare provider. If you would like more calm, evidence-based discussions on heart health, aging well, and prevention, consider subscribing. I'm Dr. Alex Carter, and I look forward to continuing this conversation with you.